Hello, and welcome back to our 10-part series on improving our democracy. So, in this part of the 10-part series, we're going to be talking about universal healthcare and how that would improve our democracy. Before I get into all that, I'd love to introduce myself. My name is Joshua Landers. Pronouns he and him are fine. I'm a student here in the Communication Studies Department. And I have been supervised on this project by Scott Lasco. The purpose of this project is to look for new solutions and new ways to improve our democracy, whether that's expanding something that already exists or getting rid of something that I don't believe is helpful to our democracy. We're just looking at ways to improve our democracy. So before we get into all that, first we have to define terms, right? Before we can improve our democracy, we have to ask ourselves, what even is democracy, right? So, what's a democracy? Democracy, democracy comes from the Greek word demos, meaning people. In democracies, it is the people who hold sovereign power over legislator and government. Although nuances apply to the world's various democracies, certain principles and practices distinguish democratic government from other forms of government. Democracy is government in which power and civic responsibility are exercised by all citizens directly or through freely elected representatives. So, just to speak on the different types of democracy, democracy got its origins in Greece, as I just mentioned. Um, and back then, it was a direct democracy, meaning one man, one vote. Um, Nowadays, here in America, we have a representative democracy, meaning that we elect officials to then represent us in the decision-making and voting process. If that makes sense. So we elect congressmen and women to serve in the House of Representatives or senators, or on a more local level, we would elect like city council people to represent us and make decisions locally. So we exist in a representative democracy. Democracy is a set of principles and practices that protect human freedom. It is the institutionalization of freedom. Democracy rests upon the principles of majority rule, coupled with the individual rights and minority rights. All democracies, while respecting the will of the majority, zealously protect the fundamental rights of individuals and minority groups. Democracies guard against all powerful central governments and decentralize government to regional and local levels, as we just discussed, understanding that local government must be accessible and responsive to the people as possible. So, if we were going to have Washington, D.C. deciding what to do locally here in San Jose, I don't think that would be very effective. They would not be accessible, they would not be responsive. So, it's delegated. Democracies understand that one of their prime functions is to protect such basic human rights as freedom of speech, freedom of religion, the right to equal protection under the law, and the opportunity to organize and participate fully in the political, economic, and cultural life of society. I hope this definition is clear for you guys. I hope we have a common ground and understanding on what a democracy is before we move on to improving it. Again, on this episode, we're going to be talking about how universal healthcare would improve our democracy. And before we go on to that, we're going to have to ask ourselves, well, what is universal healthcare? What is that? So, universal healthcare is a system that provides quality medical services to all citizens. The federal government offers it to everyone regardless of their ability to pay. This comes in three different forms: single payer model, social health insurance model, and national health insurance. The most industrialized democracies in the world have implemented one of the three forms of universal healthcare coverage. Does anyone know what healthcare coverage America has? Bonus points. I would give you a brief history of American healthcare. I had a video to share with you guys, but based on time restraints, I'm not going to be able to share it with you. But I do recommend you go ahead and click that link and take a look at this video. Instead, I need the time to go over the different models of universal healthcare. So, the single payer system In a single payer system, the government provides free healthcare paid for with revenue of income taxes. Services are government owned, and the service providers are government employees. Every citizen has the same access to care. The United Kingdom developed the single payer system. Other countries include Spain, New Zealand, and Cuba. The United States offers it to veterans and military personnel with the Department of Veterans Affairs and Armed Forces. So a lot of people here, it's paid for with tax dollars, and that is very scary. That's very scary for a lot of people. It's actually used as a scare tactic by people in the media, saying that it's going to be, paid for out of your pocket and stuff like that. But when you really think about it, so are firefighters, so are an ambulance, so are police, right? So many of these things are socialized because we know we wouldn't say if there was a burning building, oh no, they can't afford it, don't go put the fire out, right? When people need care, we give it to them, right? So if you view healthcare as a need, then it should be provided by the government. So onto the social healthcare insurance model. So countries that use social health insurance model require everyone to buy insurance, usually through their employers. Employers deduct taxes from employee payroll to cover the costs. The taxes go into a government-run health insurance fund that covers everyone. Private doctors and hospitals provide services. The government controls health insurance prices. Germany developed this system, which is also known as the Bismarck model. France, Belgium, the Netherlands, Japan, Switzerland also use it. The US Obamacare system also requires insurance, but there are many exemptions and the rule is no longer enforced by penalties. All right, so I hope we have a good understanding of the social health insurance model. It requires insurance, but the government controls the health insurance prices. And then we have national health insurance. National health insurance model uses public insurance um, to pay for private practice care. Every citizen pays into the national insurance plan. Administrative costs are lower because there is one insurance company. The government also has a lot of leverage to force medical costs down. Canada, Taiwan, and South Korea use this model. The US Medicare, Medicaid, and TRICARE systems are based on a national health care insurance approach. It's just not extended to all Americans. So I think primarily, although I would love for us to explore the single payer and the social health insurance model, in this video, I'm mainly just advocating for the expansion of the US Medicare and Medicaid and TRICARE systems to every single American citizen. So as we move on here, we're going to talk about the advantages of universal healthcare. So it lowers overall health costs, it lowers administrative costs, it standardizes services, it creates a healthier workforce, prevents future social costs, guides people to make healthier choices, less Americans die, and more Americans get treatment, right? And I think another advantage that I didn't mention on this list here is the preventative advantages that come with this. Because people have a fear of having to pay for medical expenses and how it could break their budget, sometimes people don't go see doctors as much as they should, and they end up with more serious long-term medical cases. So in a system like this, it makes preventative medicine more accessible. So when we talk universal healthcare, all we want is that anybody who's sick can go to the hospital, go see a doctor, and get better, no matter how much money they have. And I don't think that's too much to ask. Neither do the rest of the countries in the world. Here's a list of the countries with universal healthcare in place. I would run out of time if I read all of them, but I'll read a few. Albania, Algeria, Andorra, Antigua, Barbuda, Argentina, Australia, Austria, the Bahamas, Canada, Chile, China, Colombia, Cook Islands, Costa Rica, Romania, Russia, Rwanda, Qatar, Ukraine, United Arab Emirates, United Kingdom, Zambia. I mean, I didn't even say half of the people there. Almost all countries provide universal health care. The United States is one of the only ones that doesn't. So this is why the USA needs to provide universal health care. Most other industrialized democracies do. With our largely privately funded healthcare system, we are paying more than twice as much as any other country for worse outcomes. In 2017, the US spent twice as much on healthcare as comparable organizations for economic operation development countries, all of whom have universal healthcare. Maternal mortality in the United States is 30 per 100,000 births and 6.1 per 100,000 births on average in comparable countries, which is nearly 5 times worse. Um, a comprehensive study conducted in 2018 found that 62% of bankruptcies are due to medical bills, and of those, 75 were insured at the time. Most people who have insurance are insufficiently covered, and one accident, cancer diagnosis, heart attack away from going bankrupt and losing everything. So I think this is really the crux of it. I don't think having a medical emergency, getting cancer, I think getting cancer has a big enough effect on people's lives. I don't think it should mean the end of their financial life or should put them in debt or bankruptcy. No one can control whether or not they get cancer. I think everyone should be covered. Why healthcare? The reason I chose universal healthcare as one of the 10 changes that I would make to improve our democracy has much to do with equality and shift in how we value each other's lives. I believe in order to have a thriving democracy, the citizens have to know that the state is capable and willing to provide medical care to the sick. Providing medicine and treatment to the ill is at the top of the list of most important issues because people's lives are at stake. Improving our democracy includes reconsidering our priorities and reimagining what our society could and should be. And I believe that it could and should be a place where sick people get treatment. And it has impacts on our democracy, our democratic process as well. Implementing universal healthcare would improve our democracy because it would be an act of investment toward the people. People are far less likely to engage in democratic process that does not prioritize their well-being. Also, 60% of Americans support universal health care. The democratic process is not rendering the will of its people is a dangerous sign for democracy. Now, that was kind of a scary part to end with, but I think that is the crux of this is that it would improve our democracy dramatically for people to get care, but it would improve our democracy dramatically for an issue that has a majority of people behind it for that to actualize. So I think it would be an incredible sign for a democracy if this issue, which most people agree on, could get changed. I have some my citations for you to look at if you are feeling inclined, and I'll talk to you next time. Thank you.